Hello Mzansi, you are listening to Farmers Inside Track, proudly brought to you by Food for Mzansi. Officially, this is the world's best podcast for 2024, as awarded by WAN EFRA, the global organization for the world's press. I am your host, Patricia Tembo. Welcome to episode 455. Today, we're unpacking an important topic for cattle farmers. This episode is set to be very informative and practical as we welcome Kenneth Malatji, animal health technician at Afrivet. He will be providing information that will help farmers ensure successful gestation periods and avoid the occurrence of calf abortions. Thank you so much, Kenneth Malatji, for joining us on Farmers Inside Track. We're very excited to have you on the show to share your expertise.
Hi, Patricia. Thank you so much for hosting me on your podcast. It is always an honor to be here and share knowledge that can help farmers to improve their farming practices.
Yes, definitely. And I'm quite excited for the topic today, seeing that you are an animal health technician. We're going to dive into animal health, but more specifically, how to avoid calf mortalities in a herd and, just advice and tips for farmers and how they can prevent that. Would you like to just quickly give a brief introduction if I've missed anything?
Production management is a critical topic that every farmer should have an in-depth knowledge of, as it directly impacts the productivity and their profitability is. So for cattle farmers, one of the main goals is to achieve a calf per cow per year for optimal herd performance. So to achieve this, a farmer needs to implement the structured daily observations of the herd. Regular monitoring will also help identify signs of diseases, reproductive issues, or any changes of behavior that could affect fertility. So nutrition, health management, and record keeping also play a huge role in ensuring the reproductive success.
Exactly, and hopefully we'll be able to provide practical and applicable information. And I think we should just dive right into it. Obviously, vaccinations are very important, and we see that especially now with recent outbreak of foot and mouth disease. So, I think most farmers are familiar with the fact that they need to vaccinate their animals, but which vaccinations need to be administered before the breeding season?
Interesting question, Patricia. Vaccination is an important preventative measure that protects the cattle from diseases. So before breeding season starts, it is crucial to vaccinate cattle against certain diseases to ensure their productive health and herd productivity. However, there are specific diseases to vaccinate against. Often depends on the type of farm setup and the area where you farm. So it is best to advise you to ask the nearest state vet or Afrivet area agent about the diseases in your area which you need to vaccinate for. And again, using vaccines to prevent diseases is a small investment with high returns. So vaccines come with a packaging set that details storage instructions, admin route, age, time of the year where you need to vaccine, and there are precautions as well to use. So therefore, read the packaging set carefully before using any vaccine or any product. Vaccination program, Afrivet, we have at the back of our product catalog. If you need this, you can contact your local Afrivet agent or our head office. So when it comes to heifers, these are some of the diseases that you can vaccinate before breeding season. So heifers, you can vaccinate for brucellosis using S19, which is 319, 4 to 7 months before of age, or you can use RB51, 3 months before the first breeding. So also we have a Vibrio respiratory combination, which can be used to vaccinate, which entails BVD, which is bovine viral diarrhea, IBR, which is infectious bovine rhinotracheitis, and other diseases. So this combination can be used 2 months before the first breeding. So when it comes to bulls, you can use the Vibrio, which you can vaccinate a month or 2 before the breeding season. Then when it comes to cows, you can vaccinate with the Vibrio respiratory vaccinations a month or 2 before the breeding season. The most important one, again, on cows, is for brucellosis. You can repeat before breeding, and remember the S19 cannot be repeated. So I think those are some of the few diseases that you can vaccinate before the breeding season.
What causes abortions and stillbirths? Just give us some information on that. And obviously disease affects the immune system of the cow, and that can lead to abortions and stillbirths. But what else would be a cause for abortions occurring in a cow or heifer?
Abortion and stillbirth in cattle can arise from various factors, including infectious diseases and nutritional deficiencies, toxic substances, and management or environmental issues. Recognizing and addressing these causes is essential for maintaining herd health and ensuring successful reproduction. So, common causes of abortion in cattle can be infectious diseases like brucellosis. So, just to stress a bit on brucellosis, we can also call it a contagious abortion in cattle. It is caused by Brucella abortus. It's a serious bacterial infection that leads to abortion, infertility, and reproduction issues. So it primarily affects the pregnant cows, causing late-term abortions, retained placenta, and weak calves. So infected cattle may also suffer from infertility due to uterine infection and other reproductive complications. So one of the major concerns about this brucellosis is that it is zoonotic, so meaning it can be transmitted to humans. So humans can be infected through direct contact with infected animals, consumption of unpasteurized milk, or exposure to contaminated bathing fluids. So that's why it's important to always wear gloves or PPE when dealing with cows that are pregnant. Then in human also, this brucellosis is also known as Adelland fever and causes flu-like symptoms, including fever, joint pain, fatigue, and severe cases. More chronic health, severe cases, and more chronic health issues. So my manager, Dr. Didi Klassen, explored the topic on brucellosis in depth on her podcast with you, which was titled How to Protect Yourself Against Bovine Brucellosis. I think it was aired on the 13th of May. It is a very important and crucial disease that can cause abortion. So other diseases that can cause diarrhea is bovine viral diarrhea virus, which we spoke about in our previous question. This virus causes abortion, birth defects, and weak calf. It also weakens the immunity of the animal, making the cattle more vulnerable to other diseases. So it is also crucial to vaccinate for this disease. Another one that I can think of, it's infectious bovine rhinotracheitis, which is IBR. We also mentioned it in our vaccination program. This one is a viral infection that causes respiratory illness and abortions as well. So it is very important as well. Those are a few that I can mention.
I'm glad that you again stressed vaccinating against brucellosis. It's one of the compulsory vaccinations that a farmer has to administer. Is that correct?
It is compulsory, but because of the lack of resources that the state has, so normally they don't vaccinate for it.
Can you vaccinate a pregnant cow? With the vaccination programs that a farmer can get from Afrivet to read the instructions and also just speak to a vet to find out which vaccines are safe. I don't know if you have anything else to add.
Yes, vaccinating pregnant cows or heifers require careful consideration to ensure that the safety of both animal and the developed fetus. So generally, it is recommended to complete your vaccination before breeding to avoid potential risk associated with the vaccination during pregnancy. However, in cases where vaccination during pregnancy is necessary, it should be done with veterinary guidance. So we have different types of vaccines. One which is killed, it is an inactivated vaccine. These ones are typically considered safer for pregnant cattle, while modified live vaccines are usually avoided during this period unless specifically recommended by a veterinarian. So vaccination during pregnancy in cattle require careful consideration, as not all vaccines are safe for pregnant animals. Understand the difference between live and dead vaccine. It's very important. So our farmers should understand the difference between a live and a dead vaccine. So just to give a few examples or explain, a live vaccine, it can also be called an attenuated vaccine. So live vaccine contain a weakened version of the disease-causing pathogen. While effective, they pose some risk when used in pregnant cattle. So what are the risks? The risks are potential for abortion. So live vaccine can cross the placenta and infect the fetus. leading to development of issues or abortion. Immunity suppression. So these vaccines can cause immunity suppressions in pregnant animals that can weaken the cow's immunity and which increases the risk of adverse effect of the live vaccine from the live vaccine. So another one is the risk of infection. Even though the pathogen is weakened, it may still cause disease in sensitive or stressed animals. The example of this disease, it can be the BVD, which we spoke about earlier, the IBR, which also we spoke about earlier. Those are the vaccines that you should try to avoid to vaccinate a pregnant animal. But again, it is always important to read your product insert on every product that we are using to check the precautions on when to use what and when. A dead vaccine, which is an inactivated vaccine, this vaccine contains pathogens that have been killed, so they cannot replicate or cause diseases. These vaccines are much safer for use in pregnant cattle. So the benefit of this vaccine is that they are safe for the fetus. So this vaccine do not pose any risk of crossing the placenta or affecting the fetus. So making them safer to use during pregnancy. So there are no risk in abortions when using this one. And yeah, I think they are recommended to use it anytime.
What is the best way to determine pregnancy in a cow or heifer?
The most effective method for pregnancy detection in cattle depends on the accuracy needed and the budget available, of course. Rectal palpation performed by a trained and experienced person is a widely used and cost-effective method. It requires minimum equipment, just a steady crash, gloves, lubricant, and making it a standard approach in many operations. So rectal palpation can provide accurate result, especially when done by a skilled person. So for more advanced and precise option, you have ultrasound examination, which can be used while it offers higher accuracy and can detect pregnancy earlier. It comes with high input cost due to the equipment required. Another method in monitoring is monitoring the return to heat estrus, which is less specific than the previous method but can be useful. An observant headman can detect signs of heat in a non-pregnant animal, though this method relies heavily on experience and attention to details, so making it somehow less reliable. So in summary, what I can say is the choice of the method depends on balancing the cost and accuracy, with rectal palpation offering cost-effective and accurate solution for many, while ultrasound provides a higher level of precision at a greater expense. So it's a farmer's choice, and it depends on the financial muscle of the owner.
How do you determine now like signs of an abortion occurring? What can be done to prevent that? Now the cow's pregnant, assuming the vaccinations are done, maybe you can give an answer if their vaccinations are already done and there's still abortion occurring and there aren't vaccinations, which would probably then be a disease. What a farmer can do in the case to see early signs of abortion occurring in the cow.
Early signs of abortion can be subtle. They are critical for timely interventions. So that's why at Afrivet we have that module that we will teach, which is the structured daily observation. It will assist you to know when you need to intervene when an animal is not feeling well. So in this case, one of the first indications may be abnormal vaginal discharges, which can include blood or mucus. This discharges is always early warning of the complication of pregnancy. In addition to this, a sudden increase of milk production may occur, signaling stress or distress in this cow. Behavioral changes. Now the cow is starting to act restless, and the cow is isolating itself from the head. These are the common signs that an observant farmer or an observant livestock handler can be able to pick up. So physical changes like a swollen vulva might also be visible. The cow may experience a loss of appetite. So an animal handler or headman should be able to see that the cow now is not eating as it usually does, and it stays behind, it doesn't go with the rest of the herd. Then if there's an underlying infection present, the cow may develop fever. In severe cases, the expulsion of the fetal membrane can indicate that the abortion is imminent or has occurred. When these signs are observed, prompt action is critical. The first step is to contact a veterinarian or a local animal health technician to identify the cause of the abortion and begin to action treatment. If the cause is infectious, the affected cow should be isolated to prevent the spread of the disease to the rest of the herd. So nutritional support also is including the electrolyte therapy can also help the cow recover from this physical stress of the event.
What happens if you've done everything but a cow is still exposed to a disease, say like we've seen foot and mouth disease being a problem in South Africa? What does a farmer do in that case when a pregnant cow is exposed to foot and mouth disease?
The farmer should immediately isolate the animal to prevent the spreading of the illness and consult a veterinarian for diagnosis and treatment tailored for that pregnant animal. Proper treatment and supportive care, including adequate nutrition and stress-free environment, are essential to the aid of the recovery and to protect the developing fetus. Close monitoring is necessary to detect any complications early. So the implication of not addressing the exposure can include potential abortions, fetal abnormalities, and the spread of the disease to other herd, farms, or cattle in the community. So leading to significant economic and of the disruption in herd productivity. Effective management and prompt action are crucial to safeguard the health of both the cow and the unborn calf, ensuring overall herd health and productivity. It is important for farmers when there's a disease, like you've given an example of foot and mouth, to always be on high alert. When they heard that there's foot and mouth in their area, to inform the local state vet and practice high biosecurity measures so that they can cap the spread of that disease.
I've noticed you mentioned in both previous questions that it's important to have observant herdsmen and an observant farmer to pick up on these signs, like you said. Thank you. How can a farmer minimize stress to ensure a full gestation period? Because we've spoken about disease, but I'm also aware that sometimes a stressed animal can also lead to abortion.
To minimize stress and ensure a full gestation period, especially in the last trimester, farmers and livestock handlers should focus on creating a calm and supportive environment for pregnant cattle. So this includes providing ample of space, comfortable kraals, and proper nutrition to meet the cow's needs. So establishing consistent routine and handling the animal gently can help reduce anxiety and avoid abrupt changes that might stress them. So regular daily observation and timely veterinary care are essential in identifying and addressing any issue before it escalates. So additionally, tools like Afrivet electroguards can play a significant role in managing stress, as it aids in the effective monitoring and management of livestock health, and further contribute to a stable and stress-free environment. So it all depends on the farmer so that they don't stress out the animals when they need to inject or they need to do anything. They practice that low stress technique to make sure the animal is not overwhelmed by what is happening around it.
With animals, it's important to consider their welfare, like you are mentioning, because that affects or influences the gestation period. And just going into our last question, when does a cow or heifer need assistance in birthing? Because we all know that nature does its course and the animals are built to know how to calve. But in the cases where there are complications, when does a farmer have to step in and call a vet?
It is always important for a livestock owner or a handler or a headman to always be attentive when it comes to the last days of pregnancy. So when does intervention or assistance is required, as you've asked? During the first phase of the calving process, if the cow get contractions, what do I mean by that? When it starts to be an easy lie down, get up again for more than 8 hours without observing the breaking of water, then there are some abnormality preventing this stage to proceed into the stage 2. So that's when a farmer should intervene. So during phase 2, if the cow or the heifer has been trying over 30 to 60 minutes and making no progress, if the cow has stopped to push for more than 20 minutes after the initial period of progress, then, and there are breaks between pushing normally should not exceed 5 to 10 minutes. So if the cow or the calf are showing signs of excessive fatigue and stress, such as swollen tongue of the calf or severe bleeding from the vagina or the rectum of the cow. So if you observe any abnormality delivery, that's when you should call a veterinarian to come and assist you in that regard.
Is there anything else you'd like to add that we haven't touched on regarding disease and vaccinations and preventing abortions?
Thank you so much, Patricia, for an interesting conversations that we had. I would just like to say, as Afrivet, we have a lot of these manuals on production management. So if you require more information about them, you can contact us on our Afrivet website and require training from us. So we can expand your knowledge with study groups, Farmers Day, Afrivet Academy, farm workers training, primary animal health care. We have all this in multiple language options. So if you need any of our services for us to come train your livestock herders, livestock handlers, we are more than available to come and assist in that regard. But yes, farmers should know or have the in-depth knowledge about this production management so that they can have healthy cows and healthy calves.
Thank you so much to Kenneth Malatji, Animal Health Technician at Afrivet. For more information on this topic, please visit www.foodforumzansi.co.za. And that brings us to the end of this episode. Remember to subscribe to our podcast on your favorite platforms. From me, Patricia Tembo, our technical producer, Megan van der Vent, and the rest of #team Food for Mzansi. Thank you for listening.